Welcome to Ways to Wellness, a show that guides you to the best ways to get well and stay well. Here we are giving you a fair stage on which to demonstrate both traditional Chinese medicine and Western medicine solutions. But we just show the different options. You are the one to decide which is the best treatment for you. Last week, we talked about how the smoke affects our respiratory system. So today we will discuss further about a common disease which is also related with smoke, cough.
最近特别很多，厉害。
最近特别厉害，为什么呢？
天气真不好。And sometimes in Shanghai in the winter, I do have a little bit of cough. Yeah.
How to treat it?
Well, since I live in China now, I drink hot water and sometimes drink hot tea.
Yeah.
Or yeah, mostly like that, and try to stay away from the pollution.
Coughing.
Yeah.
Yeah, a little bit of coughing.
A little bit of cough. When?
Oh, just in the winter time.
I have cough every day, and I'm confused why, I don't know, but it makes my health really bad. Because of my cough, people around me don't feel comfortable, and they're trying to stay away from me.
Ladies and gentlemen, let me introduce you our patient and doctors of today. Our patient is Dennis from Russia. Hello, Dennis.
Hello.
Welcome to our studio.
Thank you for having me.
And we have two doctors here. Doctor of Traditional Chinese Medicine, Dr. Li Zhen from China. And Doctor of Western Medicine, Dr. Bettina Lai from Canada. Welcome you both. Thanks for having us. Dr. Li Zhenyu is a professor in Shanghai University of Traditional Chinese Medicine. He specializes in combining massage therapy with acupuncture and Chinese herbal medicine in his treatment. Dr. Bettina Lai works as a full-time emergency physician at the Shanghai United Family Hospital and Clinics. Dr. Lai received her medical degree from the University of British Columbia in Canada. She's board certified in family medicine and emergency medicine in Canada.
I wake up every morning, I cough. Before I go sleep in the evening, I cough. I can't sleep like this. It affects me really a lot. In the morning, when I get up, I feel very dizzy. I can't concentrate. I tried to use a lot of different medicine, but nothing helps me. 我想问一下，pan hatay有吗？Nobody understands me. Even recently, I lost my job. Because of my cough problem, I feel very miserable. I hope doctor can give me some advice.
Dennis, can I ask you, when did you have this kind of cough?
For the last 3 years already.
3 years, that's a long time. Mm-hmm. So, Dr. Lai, I feel really confused because to me, cough is like a symptom of a cold that will be cured like within several weeks. So why Dennis has this cough for so long, for 3 years, and cough so seriously, strongly? What's the difference between cold cough and
very
Dennis
smart
cough?
question. So Dennis has had symptoms for 3 years. He's also a smoker, and there is a difference. Yeah, there's a difference. Most of the time when you have a cold or a flu, people do cough, and that's infectious. So it is an infectious type of cough. It usually doesn't last longer than 3 weeks. If it goes to 8 weeks, then we're talking about a chronic cough.
So in Dennis' case, what is his cause? What is his type of cough?
Well, according to the examination that I've done, we did do an x-ray of Dennis's chest to make sure there was no infection or tumor or anything that was to rule that out. And also I recommended doing a pulmonary function test. And in his case, I do believe that it's most consistent with a chronic bronchitis or COPD.
Dr. Lai just said that Dennis' cough is not a chronic one. It's a chronic bronchitis. So do you agree with this conclusion?
So for TCM, before they make the diagnosis, the doctor should take a pulse first and then can tell you.
So we can't make a diagnosis without taking the pulse?
Yes. The pulse is slippery.
What is slippery pulse?
Yeah, slippery pulse indicates the body has the flame or the dampness inside.
A slippery pulse is a diagnosis in traditional Chinese medicine that describes the pulse coming and through smoothly, feeling slip to the fingers like beads rolling on a plate. It mainly indicates phlegm and dampness. Pregnant women may also have such a pulse.
And please show me your tongue. Okay, the tongue just greasy and also has a little bit teeth mark inside of the tongue. That means the deficiency of the spleen. And also combined with your pulse taking, your pulse is slippery, also indicates the deficiency of the spleen and also deafness and the flame inside of the body. So develop the sputum, and then there you will cause the cough.
Traditional Chinese medicine holds that the spleen is the source of the sputum, while the lung is the house of it. When there is a deficiency in the lungs and spleen, the capacity for transporting and transforming the liquid inside body decreases, which turns the liquid into sputum. With the sputum stored in the lung, the qi is blocked, thus resulting in chronic discomfort and the susceptibility to coughing.
What is the specific cause for diabetes? First thing is quit smoking. Quit smoking. And then the second thing is he can actually, I can prescribe an inhaler. Inhaler. With the symptoms and decreased inflammation in the airway. Because coughing is a reflex. Something gets in, then the body wants it to come out. So we try to cough it out. Yes. So what medicine does is helps decrease inflammation in the airway so that it decreases the coughing.
Excuse me. We understand that the air purifier is very functional. It will clean the air inside the room, less pollutants, and it will be helpful to our breathe. But you also mentioned air humidifier. So what's the function for that?
It is air humidifiers actually bring water molecules into the air and make it a little bit more moist. So when it's dry air, it actually causes you to cough because it's a cough reflex. So if you have a little bit moisture in the air, then it does help decrease that reflex to cough. And that can help with some people. If you have bad enough bronchitis, then it won't help. So it's one of the things that you can try, and it does help with the symptoms. But there are other therapies.
It's minor treatment, not a major one.
Especially if you're a chronic smoker or have a very bad cough, it will help a little bit, but it won't stop.
Not revolutionary.
Yes, that's right.
Western medical treatment: quit smoking, use an inhaler, use an air purifier and a humidifier. That is, we have learned a lot from Dr. Lai, so now let's ask Dr. Li for some advice.
Yeah, so I will recommend you to eat some medicated diet. We call it the white radish soup.
But it's a white radish.
This is the white radish. It's a very common vitamin, plus the crystal sugar, and just boil it to the soup. And you will take it, and it's helpful improve the function of the spleen and also can relieve the sputum.
Want to know the steps in starting a medicated diet at home? Follow along. You need to prepare 1 radish and several pieces of crystal sugar. Add 800 water. Boil the ingredients together over heat and then stew the soup over low heat for 2 hours. Eat 1 bowl every day.
Very sweet.
Very sweet. Actually, if you do have a sweet tea, then you can put more crystal sugar. So, to me, it's very sweet and it's my type.
It's very unusual taste for me, but I really like it.
So you can take it as dessert. But in the summer, we can make a lot of radish crystal sugar tea and put it into the fridge. And then you come back home and drink it freezing. It'll be very fantastic instead of salty drinks.
Yes.
Dr. Lee, what is the philosophy behind this soup? The white radish and the crystal sugar. So why the combination is good?
Yeah, because the crystal sugar has function to nourishing the blood. So white radish also just have for relieve the sputum. So that's why, combine it is very beneficial for your body to stop the cough and expel the sputum.
As the Chinese saying goes, eating radish in winter and the ginger in summer makes one strong and energetic. After tasting the delicious soup, what else plan do you have for Dennis?
Yeah, we also can apply the cupping salve. cupping therapy, we just apply on his back. So we choose the anchor points on the back. We call the phase BL13. So these anchor points just related to the lung. So that means we say we can directly treat the cough, because in the viewpoint of Western medicine, just cough belongs to the problem of the lung. Traditional Chinese medicine also will combine with the evidence-based medicine. Yeah, because we both just focus on the clinical proof, not the same aspects. I think a different version.
Dr. Li uses cupping therapy and aims for the facial acupoint in order to treat chronic bronchitis. The facial point is related to respiratory diseases such as pneumonia, bronchitis, and tuberculosis. Cupping the facial point can help to remove dampness and heat in the lung, relieving lung-related symptoms. Here are some notes for cupping therapy. A lying position is preferred. Refrain from moving to prevent the cups from dropping. Keep warm indoors to avoid catching a cold while cupping. The cupping should last less than 10 minutes. Don't take a shower within 6 hours after cupping. Do cupping 2 to 3 hours after eating. Make sure to go to a clinic with medical qualifications for treatment.
We also have another therapy, acupuncture.
Acupuncture.
Yeah, so now I will just apply the needles on your acupoints on your body.
Acupuncture is a traditional therapy in Chinese medicine. Its source can be found in the Yellow Emperor's Canon of Medicine, published during the Warring States period, in which many theories and techniques related to acupuncture were recorded. This therapy has been popular in China for more than 2,000 years and is now widely used around the world. Acupuncture mainly works to smooth the meridians by stimulating the acupoints, thus helping balance the function of the organs and promote the circulation of qi and blood.
The cottons and sterilize the acupoints. And then apply the needle. This is the tube needle. It's very safe.
That special needle.
What's the difference between the traditional just needle with this tube needle?
Yeah, tube needle, because the doctor's the fingers is not touch on the needle body, so that is very safe. How do you feel about?
No, I actually don't feel anything.
I don't feel, yeah. Yeah, just
I feel something inside, but there is no pain or no particular feel. Oh.
Right? Yeah.
Okay. And I feel really warm now.
Yes.
Very warm, yes.
And feel the sore or the feelings, yes, just like that.
Yes.
And then we can regulating these acupoints called LU5. Yeah, it also have for the lung function to stop the cough. This is the place, the LU5. In Chinese, we call the 齿泽. This acupoint is just located in the lung meridian.
The 齿泽 point is one of the most important acupoints on human's lung meridian. By applying acupuncture to the 齿泽 point, the lung meridian can be cleared, yin and yang harmonized, and pathogens expelled.
For the one point, we just retain the needles just for 3 to 5 minutes. So if sometimes just for the situation is serious, we say can retain the needle for a relatively long time, maybe 10 minutes. And also come to the hospital every other day. After the 5 minutes, I just take out of the needle. No pain?
No.
Yeah, no pain. Okay. No pain, no bleeding.
Dennis, how do you feel this needle deep in your arm?
It feels okay. It's a little bit numb, but a little bit sour, but it's...
And so your face flushed?
It's flushed because it's really unusual for me. I didn't know what to expect, and once needle was in already, No, it feels quite great. Not great, but just normal, let's say.
Is it a bit warm?
Yeah, after the needle was inside, it suddenly began to feel very warm at this point. And not just this point, the whole body began to warm up. But my body probably warmed up because of the excitement.
Excitement?
Yeah.
Because of your nervous?
A little bit.
A little bit, okay. But it's quite safe.
Here are some notes for acupuncture. Get the acupuncture treatment at the clinic with medical qualifications. Before acupuncture, patients should keep calm, eat something, and choose a comfortable position in case they feel faint during the procedure. Actually, with a joint effort from the two doctors, how do you feel now? Like, what have you learned from the doctors?
Well, from what they told us so far, I feel it's like two different universes. From what Dr. Lee told me, I just feel it's magical. But I'm a really open-minded person, and I would like to try anything that can help me be better.
I hope that 3 months later you can call me and say, "Thank you, Waste to Wellness. I am recovered."
I hope so too. And I definitely will try both ways.
Well, wish you good luck. Eventually, Dennis made a treatment plan for himself. He will implement a Chinese medicated diet to improve his lungs. At the same time, he will also follow the Western doctor's advice to quit smoking and use an air purifier and humidifier indoors to relieve his coughing. As for treatment, Dennis will try the acupuncture. If these methods produce no effects, he will consider using an inhaler.